APRN Prescriptive Authority for Physical Therapy, and Representative Allen was here and received the award because of her substantial work on that effort. You know, the experience I've had as a nurse in my family is that virtually every person in my extended family that's ever received physical therapy is because I advocated for it. I mentioned it to the prescriber, usually the physician, and then they said, oh yes, they might benefit from that. And it's been the thing that's made the difference. So nurses can have tremendous impact and increase the access of patients to physical therapy. We have empowered additional data collection from professionals, just giving the State Board of Nursing additional power to track the kind of practice that people are in influences our decisions. We've adjusted the proportion of chart review that was necessary for a physician working with an advanced practice nurse. And then the Nurse Licensure Compact has been, and that's a whole presentation in itself. The Nurses Association worked against a nurse licensure compact for many years, and then eventually came to the conclusion that we were probably trying to stop the inevitable. And so it was kind of join in and influence the process of knowing that something needed to be done. Other proposed legislation, I actually filed legislation to create a healthcare workforce commission in the state of Missouri. Missouri is one of the states that does not have nearly as much data about healthcare professionals as many other states do, and so it's extremely difficult to do the planning that is necessary to fund education programs and influence practice. So we really need to work on that. I also filed legislation that would create a healthcare policy authority for the state of Missouri. There are many, many, many different agencies in Missouri that even make decisions about low health net money and how that is spent. And they rarely talk to each other. There's little coordination. And so the Healthcare Policy Authority would require coordinated healthcare policy for a state. Kansas has done it and has saved millions and millions of dollars just by being really efficient with their healthcare system. Just quickly, implementation of the Institute of Medicine study, and I just put up on the slides this landmark Institute of Medicine study that is out there, and I'm just so proud of the Missouri Nurses Association that's moving forward with that process. And I will sit with a group this Friday in a think tank on how to implement these recommendations here in the state of Missouri and how MONA can be involved in that. Nurses should practice to the full extent of their education and training. Isn't that groundbreaking? We're going to have to be there to help make this happen. Nurses should achieve higher levels of education through seamless academic progression. Been trying to do that for a long time, haven't we? I get a daily verse in my inbox, and a scripture from Proverbs came across this week that I thought was apropos to this point. Give instruction to the wise, and they will become wiser still. Teach the righteous, and they will gain